Okay, guys, if you can see me on Facebook Live, please, guys, let me know. And also, please, guys, let me know if there is echo, or you can hear me clearly. Let me check the side here. Okay, guys, seems like I'm on the Facebook Live. I can see myself there. So how is everyone of you guys? How are you doing? Let me check. I see Dr. Lev says hi, hi all. Hi, Dr. Lev. Dr. Nikita, how are you doing? Good evening, everyone. Good evening to you too. Hi, Dr. Hash. Thanks very much letting me know. Cannot hear me? Guys, am I audible? Dr. Nikita says, cannot hear me. I hope I'm audible. Dr. Sangita. How are you doing, Dr. Sangita and everyone? Dr. Sami. Hi, Dr. Sami. How are you going? Dr. Eshika. Thanks very much, Dr. Eshika and Dr. Natalie, Dr. Sarah, Dr. Lev. We are great. How are you? Thanks very much, Dr. Lev. I'm great too. As long as you're happy, guys, I'm happy too. Hi, Dr. Kelvenda. How are you going? Dr. Sabika. Dr. Sabika. Dr. Nikita. My health, it's better right now. Thanks very much for asking, Dr. Nikita. I really appreciate this. I hope you also healthy and successful all the time. Dr. Mariam, how are you going? Dr. Melzman, Dr. Saral, Dr. Nishma, Dr. Rohi. Thank you very much, guys. Dr. Pico, Dr. Parsia. Thank you very much, Dr. Parsia, letting me know. Dr. Leo, Dr. Mubashir, and every one of you guys. Okay. Dr. Melina, how are you going? Thanks very much. Okay, guys, now, today we're going to discuss one clinical case. Let me share the screen. What do you expect, guys, a clinical case for today? No one will expect it anyway. You know what? If you expect it right, I'm gonna pay you $10. But you need to meet me personally then. Let me check, guys, what exactly you are expecting. Sedation. Why? Because I did post for sedation right now. Only $10. Yeah, I will type my name on it. You can sell it for 20 then if I type my name in it. Oh my God, how do you know uncooperative child? How guys do you know oxide? Because I posted for it? No, it was yesterday actually when I was going through the new TG and then I found now clearly mentioned that's minimal sedation is for general dentist. And then I was like thinking, oh my God, why? These candidates, I used to tell them before, nitrous oxide is for everyone. You can do it. You are a dentist. It's just only 1 day course. But they used to say, no, my friend told me this. This person told me this. It's not my scope. I cannot say it. Now they know. Now they know. And they fail because of this such wrong information. Okay. No one has mentioned it. No, it's not sedation, not uncooperative child. Syphilis, I was very close to do syphilis, but I changed at the end. Infection control, no, Dr. Mustafa. Okay, guys, let's start right now. Anyway, who is happy to do role play? Hypoglycemia, no. View, read in view. Let me share the screen. By the way, guys, please let's every one of us congratulate our 5 champions. You know what, guys? The problem is I really keep running to be able to congratulate them. Only yesterday I was able to congratulate only 2 champions. But today I got to know there are 5 champions. And I was like, should I do my PowerPoints or should I congratulate them? I said I will do both. I will do my PowerPoints and then congratulate them while I'm in the session. So guys, please, the feelings when I see the champion pass exam, it's a big event for me. It's a big event. It's a big happiness for me because I have seen exactly like you. You see now, for example, I think the admins, they're not awake. Where are the admins? The admins not there. Okay. Okay, guys. So like you right now, if I check all your names here, let's say Dr. Parsia, for example. Dr. Parsia, Dr. Lev, Dr. Musa, Dr. Melzma, Dr. Mustafa, Dr. Eshika, Dr. Hanan, Dr. Steele, Dr. Anon, Dr. Leo. Oh, see, guys, I'm just reading name. Dr. Hash, right? One day, after maybe few months from now, could be a month or two, you're going to pass the exam and then I see your name, pass the exam. You see how much happiness I will be in because I remembered you. I remembered who you are. That's why, guys, I'm really very happy when I see this champion pass the exam. So please, guys, congratulate them. Let's, guys, please congratulate them. Dr. Nathan passed the exam. So please, guys, say congratulations to Dr. Nathan. And then there are Dr. Athira, 2 Athiras. Dr. Athira, Suresh, and Dr. Athira, Pragnat, and Dr. Hira. I think there are 5 or 6 right now. Dr. Kayati and Dr. Monasri, definitely. Guys, amazing, right? Amazing when you have 5, 6 people passing every batch now. Should be good motivation to every one of you guys, right? Okay, so I pray to every one of you guys pass the exam and you will do it and we celebrate you. Back again, let's guys confirm this information. Nitrous oxide is for general dentist. In exam, when you get cases when the patient is anxious or uncooperative because he's anxious, don't be scared to say nitrous oxide. Say it with brave. Otherwise, if you don't say it, you're gonna miss points and you may fail the exam. Where about this information coming from? Check the new TG. Okay? Okay, let's start right now. Who's guys happy to replay today? Who is ready and happy to do replay? You can guys please raise your hand there on Facebook, sorry, on Zoom, or you can mention your name on Facebook. On Zoom, I can see Dr. Nikita, Dr. Larry, Dr. Lariant, Dr. Asta, Dr. Melzma, Dr. Musa, Dr. Mustafa. Okay. Yes, congratulations to all of them. Okay, let's see, guys. Dr. Nikita, did you do role play before? Who guys didn't do? Because Dr. Nikita, Dr. Larry, Dr. Asta. Who guys didn't do role play before? Please, Dr. Musa, if you can drag your Zoom screen right and left, you may be able to see it. Let me just unmute you, unmute you, unmute you. 3 of you right now.
Hey, Dr. Peter.
Hi,
Guys,
Dr.
can you hear
Vida.
me?
Yes.
Unmute you, unmute. Let me do something because actually Zoom, because I need to get, okay. Okay, this one here. Guys, if you talk right now, I want to be able to hear you. Give me 1 second, please, guys. Office, yep, join. Where it is, where it is. Okay, guys, can you hear me right now?
Yes.
Loud and clear.
Thank you very much for confirmation. Okay, so guys, I can see here Dr. Let me check. I believe Dr. Asta, and then Dr. Larry and Dr. Nikita. So, guys, Dr. Nikita, did you do role play before?
Yes, I did last Tuesday.
Okay, you're gonna be next week then. Okay, next
Yeah.
time.
Okay. Yeah.
Thank
No
you,
worries.
Dr. Nikita.
It
No
was
worries.
really good, by the way.
Yes, yeah, I still remember.
Thank you.
No, bro, thank you. Okay, Dr. Asta, did you role play before?
Yes, doctor. I did only one, but I have
Okay,
done it before.
no problem, Dr. Asta. Dr. Larry, did you do role play?
Well, haven't done in a long time, but if Dr. Asta wants to do it, then that's fine. All good.
It's up to you guys, whatever. Like, I'm happy with Dr. Larry, but I think Dr. Asta did it. When did you do Dr. Asta?
It
Was
wasn't
about
that long ago. That's okay. I can do next time. If
next
Dr.
time then?
hasn't done it for a long time, so you can go
Okay,
time.
that's fine. Let's now go with Dr. Larry then, and then you guys next time. Okay. Okay. Definitely, guys. Dr. Larry, can you just try to guess what is the case about?
Clinical case, great Tuesday. All right. Well, it's gonna be a great case, that's for sure.
Okay, 1 second, please. Dr. Asta, did you text me right now? Dr. Asta, did you text me right now? No, right? Let me talk. Let me. Because actually, I got. Did you text me?
No, Dr. Bido.
Because there is Dr. Asta just text me right now. Hello, Dr. Bidu. I passed the practical exam. Thank you very much for help and support.
Oh,
Yeah, I. How come? I would
yay.
like who's like how come she's doing role play with me right now and she's telling me I passed? Dr. Asta Skatchva. Oh yeah. Wow. You see, down at 6 people now, 6 hours.
Yay.
Wow. I'm very proud of you guys. You see, always good news.
Of course.
I'm very happy now. I'm very happy now. Six. I don't know now. I need to talk to her. No, no, no. I will talk to her
You
later.
wanna hang up the session?
Uh, yeah, no, if happens, I always feel happy to talk to them.
Mm, so
You see,
cute.
guys, yes, that's just now, 2022. Wow.
Ask her to join the session. Talk to
Okay,
us.
let's see then.
Just get her on a conference call.
Very, very. I cannot type properly then because very, very happy for you. You know what? Sorry, guys.
Oh, good.
I'm very happy for her.
You're such a nice tutor, you know.
Huh?
You're such a nice tutor.
Thank you very much, Larry. Thank you. You guys, because of you. Look, just now. Let's guys say congratulations to her. I love this spirit like a family spirit. That's Rasta. Do you remember how she was doing role play last time? That's Rasta. I don't know if you remember her or not, but I was saying that she was very good. And by the way, that should be a good sign to Dr. Asta. That's you go on
Yeah.
pause in Dr. Asta.
I will be next, Dr. Vidor.
Yes, I will
Yes,
remind you and
that's
remind everyone.
attitude.
Huh?
Yes, I will be next, so you'll remember me.
Definitely, I will remember you.
That's
Ah, okay.
attitude.
I
I like
cannot
it.
because anyway, I will give you three minutes reading while I am writing message to congratulate her. And this is
Okay.
she's going to be like, wow, that is the quickest congratulation ever. She's like, what's happening? Okay, that's the case. Look, easy case.
Where is the case, Dr. Oh, okay.
Can
Yep.
see right now why it's not the screen not clear, right?
Yeah, no, I get
Okay.
it.
No,
Okay.
but okay, yeah, that's fine. I can see. Congratulations. I'm very happy for her. Please, guys, everyone congratulate her. I posted in our part one group. Okay. Okay. Larry,
Mm-hmm.
what do you think about this case?
What do I think about this case? It's a very interesting case.
I'm very happy to hear this. So, do you have any question or would you like to discuss with me any of the important information here?
Dr. Vita, we can either discuss or I can do the role play and then we can discuss.
We can discuss some points in the beginning.
Yeah.
I just only want to know the roadmap, how you think about it. What are the main points you need to discuss in this case? What do you think how the case should go? Definitely, we do never have any preset mind about anything.
Yeah.
But just tell me, and if you have this case in the practice,
Yeah.
what exactly the things the patients may ask about? Where about the patient's concerns? What you need to explain to the patient?
All right. So basically, we have a patient that's come to a practice complaining of some white patches
Yes,
or a
about
white
that.
patch on the right-hand side of the buccal mucosa. So basically, the patient is also telling and reporting that has some burning sensation for the past 1 month, which obviously we need to take into consideration. That's a chief complaint. And then we also have a history of aspirin intake, and we also have a couple of amalgams on the right-hand side as well.
Yep.
So the ball part says diagnose the condition. So I'm not sure what room this is, but if it says diagnose the condition, then it gives me an indication that it would be a diagnosis and management cluster.
Totally agree.
And
Yes.
with appropriate management and address the patient's concern. So basically, in terms of the information gathering, I got plenty of information. I would basically ask if this burning sensation is continuous or it has happened before, because when it's going on for like on and off for quite a bit of time might be a bit concerning as well. And the amalgam fillings, how long have they been there for, if there was any issues beforehand. In terms of the aspirin, if like it's something that is for any medical conditions that the patient's having, what sort of medical condition is he having, so I can include it as part of my management. And then I'll jump straight into explaining what is going on, which in this particular case, it can be multiple reasons. So number one could be an amalgam sort of reaction, because there is amalgam there, so I'll need to check. There could be some aspirin sort of burn, because the patient is chewing aspirin, and that could be could produce or could result in aspirin burn and this white patch. Or it could be maybe lichen planus, is the patient having this same bilaterally. So usually lichen planus is an autoimmune sort of response of the body, and most likely could be bilaterally. So, but the main thing is that either or, the white patch has been there for a month, so it needs to be extra investigated so we know and find out what's going on. So we need to refer the patient to the oral medicine specialist.
Okay, great then. So your management today is you would love to check on the patient with some risk factors or maybe some history about the condition. Then,
Yeah. So I will check everything around. Obviously, I need to check, if the
but what is
amalgam
the
is
again?
deficient
Can you
as
please
well.
tell me again? Can we because once I get into the question part, I really feel upset. I don't like
I
such
know, I know.
questions about.
I know, but in this particular case, it can be because of, in my opinion, can be because of three
Okay,
reasons, right?
let's discuss the importance or significance of these questions. Okay,
Yep.
let's start now with the first question. What sort of question you may ask the patient about?
So I would ask the questions of like, how long is the burning sensation been there for?
Okay, now how this can help situation your management today? Look, if you give me justification, I will be happy because maybe
Yeah,
yes, maybe you think about a condition or maybe you think about a point which it's not in my head. So now tell
yeah,
me.
because it might be because of some sort of like food that he had yesterday, or it can be something
Good.
that is
So you can ask about
constant.
aggravating factors.
Okay.
Anything to make it worse. I'm happy with this. I love this
Yeah.
question.
Okay.
Okay, if anything does make it worse,
Anything that triggers the burning
very
sensation.
good.
Yeah.
This is gonna
Yeah.
help my management. Why? Because if it's,
Yeah.
for example, I may say yes, when I eat spiced curry, okay, so know what? It's better to just avoid.
Avoid it. Yeah.
Yes, so like the
Absolutely.
carrot now. Do you get my point?
Yeah.
I love this one, but not the. I don't know if you're telling me why duration can be important, I will be happy.
Okay.
The duration of the condition itself, for how long it is there. Maybe
Yes.
maybe
India
recurrent.
scenario said that it's been there for a month.
Yes, maybe recurrency. Is it
The
the
recurrency. Yeah.
yes? Is it first time or it has
Yeah.
happened before?
Yeah.
This question, examiner as an ADC examiner or in part one and part two, they love this type of information. Why is this? Because this is can be one of the red flags. Red flags
Yeah.
and the condition is recurrent or persistent. So this is a red flag we need to record in our notes.
Yeah.
Get my point? Very good. What sort of question would you ask as well? Would you like to ask?
So in terms of the aspirin intake, like why is he chewing
Very good.
aspirin?
I love this one because yeah, that is a good one. When the question is good, why? Because I need to know, does he take him under guidance and supervision from GP or by himself as over the counter? Very good. I like this
Yeah.
question. Maybe it's fine. What else?
Yeah, so in terms of the well, yeah, maybe the amalgam placement is not maybe yeah, they're old, but I need to
Yeah,
check, right? Like
but it
how
is
old the
old today.
amalgams are. Has he had any issues before with these
Yes, it's sharp
amalgams?
edges. I can see one sharp edge here as well. So you can
Yeah.
confirm this. Yes,
Yeah.
you can. You check it by yourself. You say, I
Yeah,
will.
exactly.
Yes, I will check if the sharp edge is there. But if you feel any sharp edges around, so I can smooth it, I can round it off or smooth it down today. What else if you want to ask? I think that's
Mm,
enough, right?
yeah, I think that's enough.
Yes, and by the way, please, I don't like you to start showering me question in the beginning. The
Yeah.
question you may need to ask in the beginning, maybe my complaint, maybe. And then if you give me some time to elaborate about my complaint, to talk, right, to say things about it. Apart from this, don't shower me with lots of questions. Maybe in between, in minute 3, minute 4, minute 5, you can start asking me questions related to what we discussed right now. Okay?
Yeah.
Okay. Now, forget about what we discussed. Be yourself.
Mm-hmm.
Okay?
No worries.
Okay. Who I am?
Mr. Beater.
No, no. I'm just a patient, right? Or maybe brother. Yes.
Oh, I thought you were asking about the name.
No, 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 no.
I
Just a
won't say Mr. Ronald. I'll say Mr. Peter.
mess a bit. Okay. That's fine. Okay. Let's
Perfect.
right now give you 3 minutes reading, or should you start right away? Or 1 minute reading? What do you think? 1 minute,
Uh, yeah. 1 minute should be fine.
1 minute? Okay, take your time then.
Thank you.
Thank you.
Sorry, Dr. Peter, can you put the timer so I can?
Yeah, yeah, I'm trying to do this right now.
Okay.
I was just doing it. You know what? I still remember now when there are 6 stars past the exam, that is great.
It is very nice.
It is great.
Do you want me to put my timer? Oh, you got
I
it.
put
Yeah,
about right.
perfect. Thank you, Mrs. Beater, for being so patient while I was doing my examination. Just to remind you, I'm
Should you
Dr.
just
Lariant.
Doctor, did you just right now say Mrs. or Mr.?
Mister?
Okay, I've heard that Mrs. Doctor. Sorry.
No, I wouldn't say Mrs. Definitely not.
Okay, then.
All right. Do you want me to start again?
Okay, let's start again. Give me one second, please. Okay. Yes, you can start right now.
Thank you, Mr. Peter, for being so patient while I was doing my examination. I'll sit you up. Let's discuss what's happening. And by the way, I'm Dr. Larian, in case you forgot. I can see definitely that you're having some white patches on your right-hand side of your cheek. And because of my notes, I can see that you're having some burning sensation. Is there anything else that you would like to add at this stage?
Yes, doctor, you're right. It's more about burning sensation, especially when I eat spicy food. I love Indian curry and Persian food, and they're very spicy. Every time I eat them, I really feel sore at this area. Apart from this, sometimes I bite my cheek too. Um, Nothing else bother me apart from this. But I'm really curious to know what is this exactly, doctor?
Yeah, that's a very good question, and I will definitely explain to you what are the possible causes and what's happening. And honestly, I love like curry as well. So, but if in the meantime you can avoid it, that would be amazing. All right, and we'll check your bite as well and make sure this is not contributing to this white patch that you're having. So, coming to the white patch, has this happened before to you? Or is this the first time?
Yeah, doctor, I remember it has happened before, but was different this shape because when I looked at the mirror, I found it looks like a network shape. Before it was more into just one patch.
Yes. And have you noticed on the other side as well if you have any sort of issues like that,
No,
or
just
you have
always on
that
the
in the
side,
past?
always where the
Okay.
silver filling is there.
Okay, all right. And in terms of your medical history, I can see that you're having some aspirin that you chew on. Is there any medical conditions that you're having? Is that all under control?
No, actually, because I have my friends, and then they have advised me to chew aspirin because they said it's good for the heart and blood pressure. They said one aspirin will actually prevent any clot to happen in the future. So that's why I buy it from Coles and then get one. I put it next to my cheek, and then I crash it, and then I swallow after this.
I completely understand, and I'm really happy that you are concerned about your health. But usually the health kind of like needs to be checked by the GP. So if you can go and make sure everything is nice and healthy with your GP, that would be amazing as well. And we don't kind of like medicate ourselves, okay?
Okay.
So in terms, let's jump into explaining what's happening, and thank you so much for answering to all these questions. So if you see this photo here, this is a photo of your right hand side, and yes, as you mentioned, there is some sort of like a red net sort of white patch going on in your cheek. And I can also see a couple of amalgam fillings or silver fillings in there.
Silver filling. Okay.
Yes, that's correct. So look, these white patches can happen because of multiple reasons. So in a nutshell, so there are a couple of fillings there. I can see that the fillings are a bit rough. So sometimes when we have sort of old fillings and they're rough, they've been there for a long period of time, they start corroding. So then they can create sort of like an allergy and create this sort of a white patch on the cheek. All right, are you with me so far?
Yes, did you doctor mention allergies right now, right? Do you have any
Yeah,
allergy, do you think?
it's kind of like an allergy. It's like a
Okay.
reaction. All
Okay.
right. So
But
that's one
doctor,
of the.
you know what? Allergy for what exactly, doctor?
So yeah, it could be like just a reaction. I'm just trying to make a comparison. Like for example, when you have an allergy and you have a rash on your skin,
Mm.
then similarly that can happen. So it can be because of the product or the byproduct of the corrosion of the amalgam that they.
Corrosion, doctor. Sorry, doctor, what
Yes.
is corrosion mean?
It's like the rust. It's like when you have a metal and it
Rust.
rusts, then the surrounding tissues can kind of like create a reaction and result in this white patch. Are you with me so far?
Yes, doctor, okay. Because
All
that
right.
was my second question. So,
Mm-hmm.
because why do I have this silver filling for more than 15 years right now, and only I get this reaction to it?
Yeah, that's a very good question. So sometimes, when the filling is just first place, is nice and sound, and then over time can create this sort of like rusty effect on the filling, and then over a period of time or years also can create this sort of reaction on the tissues. All right.
Okay.
So the second possibility here that I can see is that you are chewing some aspirin. It's been shown that by the research that these sort of medication can also create some sort of like a burn on the skin of the mouth and create these white patches as well. So that's why it is a good idea to see the GP, make sure everything is nice and healthy. And if you don't need the aspirin, then that potentially could minimize the risk of this condition, if at all that's the case. Are you with me?
Yeah, doctor.
So the third sort of possibility is that since this sort of white patch is kind of like a red or net sort of appearance. It could be something that we call lichen planus, which is an autoimmune sort of condition. And the only way, by the way, to find out what's going on in the nature of this white patch is just to take a small sample of this area and look it into the microscope, which we call biopsy. All right. So I would definitely have a very thorough look around. I'll check the fillings. I'll make sure they're sound. If they're not sound, then we can do some treatment about it. And in terms of the aspirin, definitely I would recommend to see your GP, as I mentioned. But the best way to find out what this white patch is and the nature of it is to refer you to the oral medicine specialist, take a sample, have a look, very thorough look, and then we can treat it accordingly if required. How does that sound to you?
I'm very scary, doctor. Very scary.
Oh
Because
no,
looking there,
Miss.
because he's going to take a
Yes.
sample of my, you said from my cheek, right? They're gonna cut a piece of my cheek, right?
No, Mr. Vito, honestly, it is a very simple procedure. They will put numbing cream, they will give you some numbing solution. You won't feel any pain. And look, anything, for example, and it's been there for a month, right? So anything in the mouth, kind of like unusual, like a white patch, red patch, any growth, like anything that is kind of like out of the ordinary or is not like white, like skin like very smooth and pink, then we should get extra investigated. And you shouldn't be alarmed. We just have to find out the nature so we can treat it accordingly. How does that sound to you?
Hey, doctor, thanks very much for reassurance. Okay, doctor, now you mentioned this sevoflurane can be the main reason behind this. So, what do you think? Looking at the photo right now, and then there are sharp edges as well. Does
Yes.
my cheek too? So, will be going to do anything today?
So that's a very good question. So as I mentioned, I will check the filling and the integrity of the filling. If there is any sort of sharp edge, I'll check your bites. You mentioned that you kind of like bite your cheek sometimes.
Yeah.
So I'll be checking your bite. I'll make sure, there is nothing that is interfering, and I'll check these fillings as well. So if at all there is any sort of like sharp edge or anything that needs to be fixed, then we'll do so. But at the same time, as I mentioned, these white patches
What do you
been
think,
there for a
doctor?
month.
What do you think? Looking at this fitting right now, do you think it doesn't need to be changed or can be kept? What do you think? Look at them right.
Look, I believe these particular fillings look a bit old to me and they're kind of rough,
Yes.
which might need to be replaced. So if
If
I
they are the
find,
reason, doctor, now I have another 5, 6 fillings on the other side too. So I'm afraid this is gonna happen exactly the same thing to the other side. I
yes,
don't want to cut my cheek again. So can you
that's
please replace them too?
look, I will check as well the other side because obviously we need to make sure everything is nice and healthy and prevent this from happening on the other side as well, if that's a cause. So I'll check all the teeth, I'll check your gums, I'll take some couple of x-rays on each side, make sure these fillings are sound. But if at all these fillings need to be replaced, then we'll do so. I wouldn't replace fillings unnecessarily, because every time you take a filling out and you drill the tooth, then it's more to structure that is kind of like missed, and that compromises tooth structure,
So,
and
doctor,
that can result in other issues.
what sort of filling do you going to use then if you replace it?
Yes, so if that's the case, we need to check the extension of the filling, and it might vary from a simple filling to an
Answer.
on-layer crown. Yeah,
That's a good then. No problem. That was great then. How you feel?
Oh, I feel okay. I just went with the flow, honestly, because usually I got in my mind like this is a diagnosis management, it's a information gathering. But this case, I don't know, it was a bit of a mix, because I don't have a kind of, I got few risk factors. I don't know exactly what it is. So yeah.
But you did well. I mean, you covered every single point. You answered all my question, and then you covered all my doubts, and then you managed the whole case nicely,
I was just going with the flow, honestly.
which is good. Which is good. That is the best way, and you've been convincing. Okay, so the good things right now. I like the way you show engagement. You engaged me nicely in the beginning into the role play as a patient. I was happy. We both been in the same platform. Look at this. I said, I love Carrie. You are smart. You said, I love Carrie too. So now I felt like we both the same. So I felt happy. That's called engagement. You engaged me nicely. Now, perfect tone. Your tone all the time was nice and perfect. It's low when you try to reassure the patient, and it was a little bit, the tone of the pitch was a little bit high when you try to explain things. So I really like the tone. You had really perfect tone. I love it very much. And then you mentioned about the aspirin, and then you said you checked, and then you said you need to refer me to GP to get for aspirin for GP. I was happy for this. And then you engaged me back again in aspirin when I said I take it because I have one of my friends told me this is going to prevent any heart disease to happen. And then you said, yes, that's good. You look after your health. I was very happy. That's very, again, engaging style. Oral medicine specialist, that's good. You may before you said only referral to specialist, and then you fixed yourself quickly, and you said you remembered, and then you mentioned who's a specialist exactly, and that's what we want. You said oral medicine specialist. Biopsy. I'm somehow against biopsy in the first instance. What I'm saying is it's better just to say that he really need to see oral medicine specialist, and because he's going to do his assessment and check this condition again. Don't, this is my recommendation, don't specify biopsy in the first instance, or if you want to specify biopsy, in this case you need to say one of the tests he may do, he may,
Okay.
but not must be, because I have felt from you that you said the only way to find out is biopsy. Do you get my point? Leave it for the definitely biopsy is very important, and this is the best ever test ever in the life. We have other tests we use it for allergies, like the patch test. Okay, it's not as specific and good as biopsy. However, I can give an idea, use the word may, could, rather than just that's the only way to know it. You get my point? Because I don't want to say something the specialist may not say, may not do it. I'm not quite sure what the specialist is gonna do. Do you get my point? So leave the specialist by themselves to decide what exactly they want to use to assess the condition. Biopsy is very important, and up to 90%, biopsy is required in this case because it's a red flag when you have white lesion on the cheek. But to prevent the confusion, because I'm not sure what the specialist is going to say. Maybe specialist may say, no, I'm not taking biopsy. Who knows? Do you get my point? Did you drop? Let me make you co-host because I think you dropped. Give me 1 second, please. Where are you right now? I can see. I have lots of words on my screen. I cannot see where you are.
Sorry, I was muted.
Yeah, I will make you co-host right now, so you're not getting muted again.
So yeah, so Dr. Peter, yeah, you're right. Yes, definitely there are other sort of tests that we can do. The reason why I went straight to biopsy is like obviously we have a red flag. The burning has happened or the white patch has happened already before, which you mentioned. And even if we do biopsy, we can find out if there is any sort of inflammation, if there is any if there's any malignancy or if there is any dysplasia. So that's why, kind of like I've narrowed it down to biopsy. But yeah, you're right. We can do also some sort of patch test as well.
Yeah.
And
So
it's been there for a month, so yeah.
because a specialist, he has the right to do anything. Because imagine
Yeah,
if I'm a
absolutely.
patient and then you as a general dentist told me I'm going to have biopsy, I'm going to specially do biopsy. What if a specialist for some reason has decided to do something else? I'm not quite sure, maybe blood test. He decided to do blood test for any reason. He has seen something, I don't know, I'm not sure about it. And then discuss this with the patient. Patient say, no, the other dentist mentioned to me, you're going to do biopsy only, no blood test. Did you get my point?
Yeah,
So,
definitely. It's better to use the word the
may,
specialist would do, may do, might
maybe,
do. Yeah,
yes, may.
absolutely. Yeah, I
Okay,
understand.
okay, good. Then what else as well you mentioned right now? You mentioned about corrosion, but
Yeah,
then you
just
said
check the
rust.
bite and yeah.
Yes, but then you said rust. That was good. It's better to do not use corrosion in this instance. Just say rust straight away. And then what else you mentioned? I love the signposting. Maybe you're not aware about it, but it became your habit. You haven't, I believe you haven't put any effort to memorize this. But it's your habit right now. Maybe you haven't noticed, but I noticed. You said the first case, the second possibility, the third possibility. Did you
Yeah,
remember you said this?
maybe. I don't know.
Because it's a habit. When you practice in the right way, it became a habit. You don't need to put effort in it. It became inside you, and right. So that's what you said. You said the first possibility, second. This is the third possibility. So it's first, second, third. I wrote it
Yeah.
here. Signpost. It was very good. Yes.
Do you want me to be honest? I
Yeah.
haven't done this case in like forever.
No, but it was very good. Honestly, it was very good. You have even you look. The most important thing is all your communication skills were right. Plus, your knowledge itself, no, your knowledge around the case was really very good too. But you haven't said something wrong. Even when I tracked you on the other side, when I said there are silver fillings on the other side, I'm worried that it's going to do the same thing for the cheek on the other side. You said you're going to check it and the double check. If you need to re if you need to remove the filling and then do another restoration there, but you said that could result in unnecessary destruction to the tooth. I was happy. It can result in a mess. I was happy with this too. Because
Yeah,
in cases of Lichenoid reaction, we don't need to remove all amalgam
yeah,
restoration.
exactly.
We only remove the amalgam restoration that is causing the
Definitely.
condition.
Yeah, yeah.
Yeah. What else as well? I think it's mostly everything covered. Biopsy, aspirin, yes, you referred patient for aspirin, yeah, stuff. Yep, I think covered. Do you have any question here at all? Let me just check this. Do you have any question for me at all?
Well, not me, Dr. Bito. As I mentioned, I haven't done this case in very, very long time. And I was caught by surprise, which is good. So I can, if I get anything in the
I'm always
exam,
very tricky, right? Unexpected, huh?
I know you're like a Pandora box.
Yes. That is good. And because I was thinking, if I do syphilis, you already may expect it. If I do any new cases, you may expect it. Let's do something not new. So let's
That's
see how,
good.
yes, how, yes. Okay.
Really
Now,
nice. Thank you,
no
Dr.
problem. Thank you very
Vito,
much. You
for
can
this
please stay.
opportunity.
Don't, thank you very
Oh,
much. Please
okay.
don't please.
Okay.
Okay. Now, don't go because we need to discuss this together. So now, guys, the case is like mostly it's Lichenoid reaction. Mostly, Mo- um, it is Lichenoid reaction. The way it was, right? Localized white striation with erythema was this is a network shape. You see right now, guys, that's very characteristic shape. It's a network shape, right? So and then close to amalgam restoration. This is very characteristic feature, very classical feature for lichenoid reaction. Often, definitely non-scrapable. Why? Because we have. Do you remember what other condition cannot be scrapable as well, Dr. Larry?
Non-scrapable.
Yes, there are some other conditions also. Most of the white papillary.
Hyperkeratosis,
Yes,
frictional keratosis.
yes.
Then yeah, because
Any keratosis,
Candida is
multiple
scrapable.
keratosis, leukoplakia, right?
Yeah, but
All
leukoplakia can be
leukodema.
anything white, basically.
Yes,
But yeah,
leukodema,
leukodema.
lichen
Yeah.
planus. Anything white. The only one mostly will be not the because alpha as well will be removed as well,
Yes.
right? Actinia,
Yeah.
candidal infection,
Candida
candidal
and
infection,
alba. Yeah.
and the alpha.
Is yeah.
There's most two conditions. Let's say conditions like leukodema, it just when you stretch it goes
But you
away.
stretch it. Yeah. Yeah.
Yes, it goes away. Okay. Now, often adjacent to dental restorations, mainly amalgam, silver filling. Mild burning. It has burning in it, by the way. It can be burning. Okay. Now, most
Lichen
of
planus also can present with
yes,
burning
definitely.
sensation.
Both of them, by the way, they are brothers and sisters.
Yeah.
Lichen planus and lichen reaction, both of them, as you said, it's an allergy reaction. And then allergy, which is can come from the body. The only difference, I believe, mostly difference between both, it's not the main difference, it is difference. Lichen planus, it happens, the body itself, it does fight each other.
No. Yeah, it's like an
Like,
autoimmune reaction. Yeah.
yes, lichen planus, but lichen reaction, it means, but both of them the same things, by the way, but it just, it's something just to make it simple and easy. Like interaction happens because local factor or systemic factor, but mostly there is a factor next to it, next amalgam, for example,
Yeah.
not just the body. So if no amalgam, let's say if no amalgam, and then this is happening, it will be the white lesion happens. So now we talk mostly about lichen planus. But if there is amalgam next to it, or maybe composite, or maybe based on nice seeds, in this case, there's a reason now. So now we're talking about lichenoid reaction. So lichenoid reaction is a reaction for something existing. Lichen planus, it's mostly happen from the body. The body fight itself. However, if you go and check the references again, they will tell you lichenoid reaction, lichen planus is the same thing. It's
Yeah.
very confusing this part. Okay, now.
Yeah, now that you're talking about that, Dr. Rita, sorry to interrupt. So even like when you talked about the aspirin as well, because aspirin is also an NSAID. So that could also potentially be one of the causes
Yes, definitely.
for
Absolutely.
lichen. Yeah.
Because it can be localized cause, right?
Yeah,
Even
like a burn, or it can be a lichen reaction.
yes, it can be yes systemic, right? And then both of them can be lichenoid because we need to look for lichenoid factor. Okay, nice seeds, blood pressure. This is mostly blood pressure medicine. Antimalarial, which is a viral. Okay, and then some graft disease, the graft versus host disease. And then idiopathic in few cases, as many lots of other conditions. We don't know why. Management. Remove traumatic factors. The sharp cusp, that should be removed. Just do this. Okay. So the sharp irritation, sharp cusp should be smoothed out. And then, no, 1 second, please.
Yeah, so the amalgam will have to be either smoothed or it might need to be replaced as well, depending on
Yes.
the status. Yeah.
I would recommend replacement because
Yeah.
actually that is going to make safe side, because the tooth itself or amalgam itself, it's not sound enough.
Exactly. Yeah.
It needs to go anyway. It does need to go. If imagine if the patient attended your practice and then he has no white lesion. He has no white lesion, and you see this old amalgam, bad damage, broken amalgam. Will you advise the patient to replace it or not?
Yeah, definitely. If it's
Yes.
effective, definitely, because it can cause more trouble.
Hmm.
Definitely.
So even without the white lesion, should be removed because it's really broken. It's old one. So now, advice on avoiding spicy, acidic foods. That was very important because curry does actually hurt me. So why should I hurt myself? Right? Sometimes sodium bicarbonate can work in this case, just to somehow make the area comfy, especially if the patient has dry mouth. Corticosteroids, that something can be happen if you can use corticosteroids, right? But this is if you're going to prescribe it, it's much better. Or you can prescribe after you diagnose the condition. You cannot use corticosteroid if no diagnosis. So corticosteroid only will be prescribed after the diagnosis, not now. Pain management if symptomatic, you think about what could be then if a patient said it does actually annoy me, it disturb me. What sort of pain management will you prescribe for this patient?
Yeah, sodium bicarbonate would be a good idea
Plus
for this patient.
benzodiamine.
Yeah, benzodiazepine could be also an
Benzodiamine will be
option.
very good because it's anti-inflammatory and nice in these cases.
Yeah.
Okay, good. Then we need to replace that adjacent amalgam with composite or GIC, and then we need to refer to oral medicine specialist or oral maxillofacial surgeon. Both of them, they will do the same thing, which is they go into check all around, they do some tests. One of them, or most important, is biopsy. But again, it's up to them what they're going to do.
Yeah.
If drug related, which is aspirin, we believe it could be in this case. So definitely we may, as you mentioned, you just refer the patient to GP to modify the modification. Follow up when you need to see this patient again. Most properly, you need to see this patient again, either to replace the amalgam or after he get the result of the biopsy, or actually you got the result of biopsy or the specialist, because normally once a specialist got the result, the biopsy result, they send you a letter and they send the patient. So in this case, either way, you see them because you need to replace amalgam restoration, or maybe today as well if there's time you can round off at least the sharp edge today and then replace amalgam next time, or you see them once you get the report from the specialists. That's it. That's all the case about.
Correct.
But things, why I feel the cases are easy cases, not hard at all. What do you
Yeah,
think?
I just find, you just have to listen to the patient. Like you gave me few concerns, few issues, few risk factors, and I just went with it, and use my clinical knowledge in terms of what it could be. Definitely, we might need some extra investigations if, there is an issue with the amalgam, we need to tackle it. Definitely, we might need to replace it, we might need to round it off. But if there is some sort of like issue for being there for a month, we might need some investigation with the specialist. It's just more like a conversation. I mean, to me, especially with a case that I haven't done for a very long time, I'm just kind of like going with the flow and listening to you. You know what I mean?
I totally agree in this part. That is totally right.
Listening to your concern, answering to you, using my clinical knowledge, and going with the flow.
Yeah, but you still need to take the lead, but the lead doesn't mean you talk a lot. People think when we say take the lead, it means they are the only people they lead the whole scenario, as if it should be only right, the way they want, and then they keep talk a lot. This is what they think about. They take a lead. No, taking the lead is
The problem with that, Dr. Beta, is that I feel that sometimes when people want to take the lead too much, it feels rushed. You know, the case feels like, all right, you want to just finish the whole case. So I can take the lead. For example, you were talking to me about the amalgam and the allergy and whatnot, and then I explained it, and then I jumped into the second possibility. You know what I mean? It's just finding the time and making sure your concerns are answered, but at the same time, I move on nicely. You know what I mean?
yeah, smooth movements. That will be the best always. Like when you
Yeah.
just speak smoothly and then don't be in rush. Try to have some pauses in between, short sentences always.
Check on
Breathe.
understanding. Yeah, because that's part of the criteria as well. You know, you need to check on understanding, involve the patient, make sure the patient is aware, and that's also part of consent all the way through, you know, making sure the patient is involved in the decision making as well.
Yes, I agree in this one. Look, there are some questions here. Guys, please, guys, if you have questions, please ask because there are lots of questions here. And these questions, okay, the question is scaling required for this patient. Do you think so?
Scaling.
Yeah.
I mean, I guess as a part of long-term management, you can talk like, all right, I'll check everything around, make sure everything is nice and healthy. We might need to see you every 6 months if you haven't been to dentist. We might need to do a clean. But the main chief
You know what,
complaint of the
Larry?
patient.
Larry, you learn now, Larry. You learn. I wouldn't say you are old now, okay? But you're learning now, Larry.
I'm a senior.
Okay.
That's terrible.
Okay. Now you know what I mean. Okay, aspirin burn or galvanic reaction due to amalgam filling in posterior teeth. Aspirin burn or galvanic reaction due to amalgam filling in posterior teeth.
Galvanic reaction due to the filling and aspirin burn because of the aspirin tube.
Yeah, the
Yeah, it
question
could
exactly
be.
is like exactly the question, or maybe aspirin burn. Maybe that's a statement. Aspirin burn or galvanic reaction
Yeah.
to.
Exactly.
Ah, okay. So galvanic reaction to the cheek.
Yeah, the galvanic reaction is the amalgam. Yeah, the rust, you know, the obviously.
But the rust it does result. I know galvanic reaction is electric shock. It's
Oh
the
yeah,
difference in
true.
ions, negative and positive ions, and this is between the two opposite amalgam restoration. Not, I'm not quite sure. Is
Yeah. No,
galvanic
that's true.
between
That's
the
true.
people?
That's true.
Okay,
You,
that's okay. Oh yeah, okay. So yeah, aspirin burn, Dr. Zoya, right? Galvanic reaction. I believe this is my understanding about galvanic reaction. Maybe I'm wrong. Okay, you go please and check this.
no,
Galvanic
you're right. You're
reaction
right.
is yes, it's a thermal. It is an electrical reaction
If
happening
there are two opposing, yeah, you're right.
in all the amalgam because difference in ions charge. One is positive, one is negative, one old, one is new, and then the patient has electric shock. Like, whoa, this one understand, but does it result in white condition, white patch? I'm not quite sure about this. I know it's a rust. It's a thin layer. It's a gamma phase 1 and 2. The rust is old one because Cu and then the tin both together, they actually give allergies to the cheek, but not the galvanic. Okay, maybe, I'm not sure. Now, there is another question here as well. You see, Rana say, he's a man, not woman. She said messes. You see,
Did I?
I was right. Even I
That's
hate messes.
bad, isn't it?
Yes. That's okay. Seems like you
But I tricked you. I said I didn't do it.
I didn't mind. I didn't mind. Okay,
Oh, how dare I?
that's okay then.
Bad.
Dr. Taslim says, I love the tone as well. Very good. Very convincing. Yes, Dr. Sabika. Dr. Hash, good role play. Really nice. Fluently talking. Confident dentist. Very good. Very, very good, Dr. Parsia. Very good and relaxed presentation, which covered almost everything without anything extra. You see, guys, I like you very much. I like the last three words. The last three words without anything extra. I loved it. Yes. I don't want someone to cover and cover a lot. It just without anything extra. Very good. Scaling required. Okay, nope. Back again. Doctor, I remember in part one, you used to say when we do referral, we don't mention what exactly. No, no. What exactly? Oh, yeah. That's good. So now that's true. In part one, when we say what exactly going to do, we never specify exactly what they're going to do. Don't say, for example, he is going to remove this condition by laser. However, if there are different options, like surgical, it could be conservative, it could be a laser, so say it can be any one of these. But don't specify only one thing. Did you get my point? So don't say he's going to treat you by surgery, because sometimes he has different opinion. What do you think about this, Dr. Larry?
Yeah, I think it's the best option is to explain that they might need some extra investigations required to find out the cause, and the specialist will decide. One of them could be biopsy, if you want to mention it, I would
Yes.
say.
So you're right, Dr. Hind, about this part. Yes. Because she was saying, Doctor, I remember in part one, you used to say when we do a referral, we don't mention what exactly the specialist has to do. Yes, because the specialist got upset sometimes when we say the specialist is going to give you removable denture. And then the specialist discussed with the patient different option. And then they said, why did you only tell the patient about removable denture? Honestly, it has happened before many times to people.
Well, I have
It
to say,
works.
I have to say, I work with oral maxillofacial surgeons, and sometimes the dentists say, "Oh, the specialist will take a CBCT for wisdom teeth," and then the specialist is like, "Oh, I don't want to take a CBCT because it's a simple case for me, but now I have to take it because the dentist said that."
Exactly. You see, when you work in the clinic, you'll find out this part.
Yeah.
True. Okay. Good role play. Dr. Nabi says this to you. It was good role play, Dr. Lev. It could be aspirin burn. Yes, she says this, Dr. Hand. As patient showing it, well, it could be differential diagnosed as a type of trauma, chemical burn. Yes. Okay, because doctor said that doing biopsy make patients scared. Two, that's very much Dr. T, right? Dr. T, right?
But I made you feel okay after I said the biopsy.
Yes,
Okay.
that was very good. After this, you calmed me down. I was happy with that. Management refer to a medicine specialist or maxillofacial surgeon to investigate it thoroughly and find the cause and treat accordingly. They may do small sampling called a biopsy, or they may do allergy tests. Regarding the broken, yes, I agree in this. You can say this amalgam will assist at least for today. I can smooth it off. Very good. You can say this one. Now that Dr. Larry covered this case, so that's how we going to do with rest of the session. Why, okay, now that Dr. Larry covered this case so well, what are we going to do with the rest of the session? Okay. You see now,
Dr. Pasia
you
can
made,
do another role
you made
play.
the,
He's
you made the
amazing.
expectation very high now, Dr. Larry. You made the expectation very high. But that's good.
Look, Dr. Pasia can do definitely a better role play, I have to say. If you want to do another one, he's a man.
Yeah, so you are very good, guys. You are very good. To make any treatment, we need 100% reason. Can I use this phrase? 100% to make any treatment, we need 100% reason. Can I use this phrase? To make any treatment, treatment, we need 100% reason. No, look, I got your point. You must find the cause. You mean this, right? You must. That's what I understood. You must find the cause to do any treatment. Yes, you must find the cause to do treatment. Yes. Leukoplakia. It can be leukoplakia. Can be leukoplakia. Hyperplastic candidiasis. Yes. Thanks, Dr. Adam. This case is very common. Thank you, Dr. T. It's my pleasure. Leukoplakia. Yes, candida leukoplakia. Yes, lichenoid reaction. We only change amalgam after biopsy, right? No. If amalgam is already broken or damaged, so you can change it at any time. But if it's sound and you're not sure about it, keep it then until you do biopsy, and then you can decide.
Yeah, I agree
Depends
with
on the
that.
mind. Yes, yes, because it does make sense. Why? Why should I wait? Should
Yeah,
when should
because
we
people
replace?
people sometimes think, sorry to interrupt. So people
No,
sometimes
no.
think that, oh yeah, we need to wait, but if you see something that's clearly like it is damage, so are you gonna wait? This anyway
I don't
needs
know why. I
replacement,
don't know
so
why they
definitely
should
you need
wait.
to do it.
Why they should wait? Do you think like if they wait and then they send the patient to a specialist, and then the specialist will not find anything
In,
to biopsy? Are you serious?
so
That's good. So
so
the
the
case has
main
been
the
sorted out. The
so the
case is traded then, right?
Yeah, the main thing is like this has been there for a while, then it's recurrent. And on top of that, also you have a clear indication that the amalgam is effective. So you need to change the amalgam or replace the amalgam if it's effective. And at the same time, refer just to make sure 100% that, it's nothing serious or sinister. And that's about it.
Yeah, but Larry, something very important here as well. People think that if they remove amalgam, so when the specialist does biopsy, they will not find any amalgam in the biopsy because amalgam already removed. I don't know, but this is real. I have heard it before. But if there is a case and then there will not be any amalgam or any reaction has happened because of amalgam, it means already the case has been treated because the reason has been already removed, the cause has been addressed. So everyone should be happy, right? But I don't think so. So yes, Dr. Ashika, I believe no amalgam should be. When should we replace amalgam? We should replace it at if it's broken, replace it at any time you want, either before the biopsy or the investigation. If you want to remove it after after maybe the biopsy, it's fine. There is no problem. So both will be okay, I believe. TG says all amalgam shouldn't be replaced. Yes, that's what we mentioned. You're right. If patient wants it, otherwise won't. We should we replace amalgam? Okay. After biopsy? Not really. How we enumerate option of investigation to patient and what we gonna tell. So doctor, what do you think? Dr. Larry,
Sorry.
the
Sorry, Dr.
question is
Bill.
how
So
we
depending also, what cluster are we in? You know what I mean? Like if it's information gathering, we might need to do full sort of like, all right, I'll check, extraoral, intraoral, but in this case, I believe this particular case, because of the ball part, is diagnosis management. So I potentially was past that, and I'm just going to go straight into like confirming that the filling, is effective, checking if there is any sharp edge, checking the cheek, and especially on the side, since you mentioned that there are some amalgam fillings on the other side as well. And then the other extra investigation would be biopsy, the oral medicine specialist and the extra investigations, and also GP referral, which is part of the investigation process as well.
Yeah, I totally agree. I believe this is in very good order as well. Okay, so the question is we need different materials for galvanic reaction. Um, Not necessarily different materials. It can be same materials as long as one old, one new. It's all about the ions. Yeah, different definitely will be much clearer to happen. Gold, for example, and amalgam, yes. But even old and new amalgam, it may happen too. Dr. Mustafa, thank you, Dr. B. Thank you very much, Dr. Mustafa. Galvanic reaction is a reaction between two different metals. For example, when amalgam comes in contact with another metal like gold, crown or metal metals. Yes, even old and new can happen galvanic, guys. Again, go and check in this part, okay?
Yeah,
Really?
but definitely I won't go into too much detail of galvanic reaction for part 2.
No, there's, yeah, I agree. Yes. Okay. What is the management of aspirin burn? Dr. Tanvir asks, what is the management of aspirin burn? What do you think,
Just
doctor?
just make sure the patient doesn't chew on the aspirin if it's not required.
Yes.
Get the GP on board. Multidisciplinary approach.
If really necessary, yes, they can just swallow. They can only, they don't
Yeah,
need to eat
exactly.
it. They don't need to chew on it. Just they actually put in the
What I've
mouth and then
heard,
swallow with
I've
water.
heard, I've heard, Dr. Peter, that sometimes people with toothache, they put like cloves or
Inside the
or
pouch, the tooth.
or NSAIDs like aspirin, next to the tooth if there is any toothache. So yeah,
Yeah,
obviously.
it happens. Yes, it happens. Okay. Sometimes I do the same, but not exactly. When I have very bad headache, and then I actually can, but not aspirin. I can get some pills and put it underneath the tongue because I wanted the effect to be quick. It happens to me.
Oh
I
well,
normally
yeah.
I normally dissolve medicine below my tongue. Yeah.
Yeah, but that's because of a medical like a reason, you know that the absorption will be quicker if you dissolve it as compared to, going through the stomach. So
Look,
that's very smart.
something happening here.
What is happening?
There is a male dentist. I think he is proposing a female dentist here.
What's that?
They ask her if she is married or not.
Who?
A dentist who is,
Who's married?
yeah, he's asking another dentist, "Are you married?"
Oh
On the
my
chat
God.
room. Congratulations, guys. Okay. What else? About placement.
Oh, this is cute. This is
Yeah,
new. I haven't heard of this
that's a
before.
nice one.
Yeah.
Okay. About replacement amalgam on the other side. Dr. Levy. Oh, okay. 100%. Yes. I got it now, Dr. Levy. Yes. Yes, there must be a reason behind it. Yes. And then he's asking which country from. That's okay. Okay. In Lichenoid reaction, only causative tooth amalgam get replaced instead of replacing whole mouth amalgam. Yes, that's true, Doctor Tanvi. Dr. Shiva, Dr. Kanika, like everyone's laughing now.
Who is
Yes,
he?
Dr.
Who is he
Taslim.
asking to marry?
Yeah,
Let's get them
and then
together.
Dr. Taslim, she's like, yeah. I think I was asking you, right?
Me?
No, not
I'm
you, not
married.
you. Not you. I was asking. That's okay then. Congratulations, guys. Okay. Dr. Viste, what about Saturday class live mock contribution, Dr. Bido? Kindly continue it. That left completely the day. Okay, Dr. Tanvir, I can do this on Saturday. I may announce tomorrow, guys. We have a session, by the way, on Wednesday tomorrow. Our part one champions, the course candidate, will have session tomorrow, guys. Okay. Yes, and then on Thursday, I may do something on Friday, Thursday. If you really have time, yes, I can do. Dr. Eshika says something here. Dr. Eshika says, let's get the conversation from the beginning. When should we replace amalgam? Dr. Eshika, answer this one. It's up to you. Maybe before or after. It's up to you. No problem. As TJ says, all amalgam shouldn't be replaced. Definitely right. We shouldn't replace amalgam. We only replace the amalgam who is the cause of this condition, not all the amalgam. And then,
I actually threw a little bit of my amalgam replacement case into this case.
yeah, because they want the same information anyway. Now, if patient wants it, otherwise we will not. Which amalgam, Dr. Anam? If no, yeah, if the amalgam does make issue, yes, definitely you should remove it. If the cause, if not the cause, don't remove it then. After biopsy, I said it's up to Dr. Ashika. It can be before, it can be after. Then yes, if it is particular due to amalgam filling. Yes, you remove it. Yes, Dr. Bidu. Yes, Dr. Ashika. I think I answered.
Dr. Vito, sorry, I have a question. So
Yes.
in this particular case, I completely forgot. Would you touch base about smoking and alcohol?
Maybe.
Because it might be
Maybe.
a contributing factor, like
Again,
smoker keratosis.
again, biopsy. Look, there is any relationship between smoking and alcohol and lichenoid reaction.
No.
That's it. It can result in maybe potential malignant transformation. Yeah, it can. It can be a risk factor for malignancy, but in
Yeah.
its own can do anything. No, it's secondary, not primary.
Okay.
I'm looking at aspirin.
I completely
Looking
forgot
at
about it, but
amalgam. No,
probably
no,
good.
no, no, no. Don't worry. They think if you forget about, don't worry. Okay, but if you forget about aspirin, if you forget about amalgam, if you forget about maybe the rough irritation, if you forget about the stuff, now it can be an issue.
Yeah.
But for smoking alcohol, I don't think so. Okay.
Okay.
No problem. Thank you, guys, very much.
Thank you so much for this opportunity, Dr.
Thank you very
Vito.
much, Dr.
It
Larry,
was
and
very
thank you.
nice. Thank you.
That was very good. Thanks very much for helping everyone. Thank you, doctor, and all the best to you then, Nixon. Thank you, guys. Thank you, Dr. Gagandi. Thank you very much. Thank you, guys. Thank you very much, guys. Thank you, Dr. Taslim, very much. Uh, Thank you, Dr. Musa. Thank you, Dr. Gagandi. Dr. Tanvi. Dr. Bido, it's my hamper request. Definitely, doctor. Do you kindly take one special public class on RPD Densha designs? Okay, I will do this. I will put this in a poll, and then I hope people will. I hope people will select it and vote for it. Thank you, Dr. Teslim, very much. Thank you, Dr. Musa. Thank you, Dr. Kanika. Thank you, Dr. Sapika. Thank you, Dr. Musa again. Thank you, Dr. Shiva. Dr. Sangita. Thank you very much, Dr. Asna. Thank you, Dr. Muhammad Salman. Thank you very much. Thank you, Dr. Tanvir. Thank you, Dr. Shiva. Shiva Sharma. Thank you, Dr. Lev. See you tomorrow then. Thank you very much. Okay, guys, thank you very much, guys. See you then tomorrow at 8 p.m. Sydney time. And then on Thursday, I will be seeing part 2 for the technical course. And then maybe Friday or Saturday we can do extra session for everyone. Extra. Thank you very much, guys. Have a great night. Thank you.